Hello everyone, this is Ferlie Almonte. Welcome to another empowering and educational episode of New Beginnings. Cancer. It has affected so many of us in the most devastating way. And we can actually prevent that from early intervention and also being able to partner with the right providers, a medical expert who will be able to guide us in making the right decisions regarding our treatments. Well, today is going to be very, very educational and very empowering because I have on the set Dr. Tiffany Pompa, who is a hematologist and a medical oncologist, a general oncologist that deals with all different types of cancer. So now we're going to delve into how it affects the senior community. So stay tuned. Welcome, Dr. Pompa.
Hi, Ferlie. Thank you so much for having me. I'm very honored to be here.
Oh my gosh, thank you so much for squeezing us into your very, very tight schedule. I know you've been seeing a lot of patients lately, and I know Dr. Pompa, by the way, because she is my oncologist. To some people, you may know that I actually have been diagnosed with breast cancer 3 years ago and had to go through different treatments, surgeries, chemotherapy, immunotherapy, and hormone therapy. And without the right guidance, sometimes it is so confusing to make the decisions. And Dr. Pompa is going to help us make those decisions more intelligently. And so, Dr. Pompa, first of all, thank you for being my doctor because you have changed my life in so many different ways. And you make doctor's visits fun.
Oh, thank
my
you.
goodness, my goodness. Anyway, I would love for you to share with the audience, what's your backstory? What got you into the medical profession?
So I think what's unique about my story is when I was young, I was actually a patient on multiple occasions. I had really bad asthma. I actually almost died from it. I had to have a breathing tube to keep me alive. And prior to that pivotal moment in my health, I was in the hospital pretty much almost like month after month. And they just couldn't get my asthma under control. And it really taught me the other side of medicine. Like as a doctor, you could sit there and guide patients on what to do, tell them about your diagnosis. But being on the other side, being a patient, taught me how alone you could feel, how scared, how a lack of understanding doesn't help. So like you said, I make the office appointments fun. I also like to be very educational because I feel like the most educated patient is the best patient because together we're a team and that leads to better outcomes for the patient.
And I could attest to that because you were very, very thorough when you were interviewing me because you had to take over my case from my former oncologist who has moved to another state. And I said, oh my gosh, she has big shoes to fill.
Yeah.
But oh my goodness, this lady is actually phenomenal in so many different ways. You were trained in 3 different states, correct?
Yes.
Give us a little bit of a background of how you were trained.
Yeah, so if you can't tell from my accent, I'm from New York. So I grew up in New York. I actually went to Wash University for my training for medical school. Then from there, I went on to do a lot of my training in New York, actually in Staten Island, at Staten Island University Hospital, where I was born and raised. 3 minutes from my house, I'd get up in the morning, go to the hospital, take care of my patients. And then for my fellowship training, where I did hematology and oncology, that's when I went into Philadelphia. That's where I went to Hahnemann University.
Okay.
Oh, Drexel University.
Well, tell me something. How did you end up in Toms River?
Oh, because my in-laws actually live here, and I heard that Robert Wood Johnson is building a great cancer center, so why not be a part of that?
And Dr. Pompa actually was highly recommended by my surgical, how do you call that? Breast surgical oncologist, Dr. Sumi Chang, who I adore. Anyway, doctor, you are in a senior community, surrounded by senior communities. I believe there's like 72 communities here. And I would love to know, what type of cancers do you see that's prevalent among seniors, 55 and up?
Yeah, so I would probably say if you walked into my office, most of my patients are 60 and above. And the most common cancers that I see are breast, colon, lung, prostate. And what's great about all those cancers is there's great screening tests for all of them. So not only as a provider taking care of patients that way, but patients also have the power to get early detection, which leads to better chances for cure, such as your mammograms. You have your low-dose CAT scans now for patients who have smoked a majority of their life, smoking cigarettes. You have your PSA, which your primary care doctor can do. And then you also have, oh, the one I forgot to mention too is skin checks, because older patients get a lot of skin cancers. And then also your colonoscopy.
Skin cancer, why would older people get that more prevalently now?
Oh, because they love the sun, right? Back in the day, we didn't have as much knowledge as we do now in regards to the fact that your sun exposure when you're young actually is more of a risk factor for skin cancer as you get older. And back in the day, a lot of patients weren't wearing sunscreen. They were out there with the aluminum foil, putting on the baby oil.
It's going to be October soon, and it's Breast Cancer Awareness Month. Actually, I always say, every day is a cancer awareness of something. So the more empowered we are with education and prevention, the better we are in having longevity. Now, I'd love to speak about breast cancer because I was, of course, diagnosed with breast cancer, and it really shook my life. Now, for the last 5 years, what would you say has made strides in terms of advancement in treatment with breast cancer?
So I think the fact that women are more aware now, I mean, 1 in 8 women gets breast cancer. The fact that the mammograms have gotten better, now we're doing 3D mammograms. There was a very important trial a couple of years ago that talked about women who have invasive breast cancer, which is the type of breast cancer that you don't want to have. They actually found that as a patient, you could take power in preventing that from coming back just through exercise. And
Exercise?
Yep, and that's weight-bearing exercise. They found it was statistically significant in women who exercised to better their health. The risk of breast cancer coming back was actually statistically lower. And they actually found out the same thing in colon cancer. And these are patients who already had the disease, potential for cure. They've had surgery, breast cancer, they do radiation, they do hormone therapy. But what patients can take under their control, aside from listening to their provider, is actually exercising.
Exercising, but weight-bearing particularly.
Yeah, that's best.
Oh, you just gave me an idea because I have no willpower when it comes to exercise. But just the fact that I know that it will prevent cancer from coming back is really a great motivation for us, right?
100%. That's why I always talk about that with my patients. I try to go above and beyond to let them know what can they do to prevent the diagnosis from coming back, especially when we shot for cure.
When we go to doctors, to oncologists particularly, I remember speaking with somebody recently, and we were kind of arguing between the staging and the grading. What exactly is the difference between a stage and a grade? So when they say stage 1 or grade 1, what is the difference?
So the grade is actually when they look at it, so when the pathologist looks at it under the microscope, so this is after the tissue's been removed, they look at how active the cells look under the microscope. The stage actually tells you where the disease is. So somebody where the disease is just maintained in the breast, that's a stage 1. By the time it gets to the lymph nodes, that's usually a stage 3. And then when it's gone, in any cancer, when it's gone outside the area where it started, that makes it a stage 4, which is not curable, but treatable.
Now, when do you say that a cancer is metastatic? Like, at what stage?
Stage 4. So that's when it started in one place and is moved to the next. Like in hormone receptor positive breast cancer, that type of breast cancer loves to go to the bone. So by the time it's done that, it's already not curable. But you could put patients on therapy just like you would high blood pressure or diabetes and keep their disease under control. So it's not like once you have stage 4 disease, there's nothing that can be done for you. In fact, people have been living a long time with stage 4 disease.
Yeah, I love the fact that you are also very big champion of preventive medicine,
Yep.
through exercise. Actually, You know, one of the things that's really incredible about Dr. Pompa is that you will see her very active on Instagram and on Facebook promoting different things. I've seen her lifting weights. I've seen her, walking and just giving talks about the different tips that she can tell you to how to live a healthier life. Now tell me, how did this passion to be on social media come about?
Well, I'm very much so. I love my job, but I also hate that it's a job that deals with cancer. And like you said, once you find out you have a diagnosis of cancer, that pretty much changes your life. So I said to myself, you know what? I love prevention. I would love for people not to have to see me. I want people to have a better, healthy life. And if I can help them do that, then I'm all in it. And that's what got me on Instagram. I actually came across, I don't know if they were a legitimate doctor or if they were just posing to be one, but they were telling women not to get a mammogram because of the radiation exposure. And they're right. There is some exposure, but until there's a better test, mammogram is still best. And if you pick something up early, you have a better chance for cure. Just to put it out there, once you've felt a mass in your breast, that's usually not a stage 1. That's usually either a stage 2 or a stage 3. So by the time you feel something in your breast, it's already a little bit more advanced than we would like, right? So that's why I went on there and I was promoting getting mammograms. I like to promote anything positive, anything about prevention, and especially anything about giving power back to the patient, where they can exercise, eat healthy, do all these things to prevent them from seeing an oncologist like me.
Recently I noticed I've actually had a few friends who were diagnosed with breast cancer before they're even 40. What's happening? Why is it being, diagnosed so much earlier now?
So too bad we don't know yet, but hopefully we'll figure it out. Some of it could be that, our diet is not good. A lot of women nowadays are a little bit overweight. We're working. We don't have time to exercise. I always promote to my patients, even just 15 minutes a day is better than nothing. Just give that to yourself. Do some sort of exercise while you're watching TV, doing something else that you love. But any time you could add an exercise, eating well, it's so important just for health in general, not just for cancer prevention.
Well, there are different types of cancers, right? But what would you say would be red flags that we seniors need to be really attuned to in terms of our bodies so that we would know, if there's something wrong, see you before it's too late?
Yeah, 100%. I think, one big red flag is unexplained weight loss. So somebody's losing weight and they're keeping up with their normal habits, what they usually eat, and they're just losing weight, the weight's coming off. That's a big red flag. The other one...
Why the weight loss? Why the sudden weight loss? What's happening in our body that causes that?
Because the tumor is actually using a lot of your metabolism. So it's actually enhancing it. It's taking all of your nutrients and using it for itself.
So that's not a good way to lose weight.
No, and I joke around. Sometimes patients will joke around with me in the fact that, I want to lose weight. And I'm like, no, you don't want this type of weight loss. Usually it doesn't look healthy. You look a little bit drawn. And there's other things that go along with it too. You'll probably feel more tired. Most patients complain about that. Any change in your stool, when you go number 2, any blood, any postmenopausal bleeding, so that's important. Any lump or bump that you feel anywhere on your body, you should bring it to the attention of your provider. But the biggest thing, I think, is just doing the screening tests. Those are very important.
Now, regarding age, let's say, for example, let's start with women. What kind of screening do we take for our age right now? What are the most critical screening tests that we must take?
Yeah, colonoscopy, mammogram, skin checks. And like I said, if somebody's a long-time nicotine smoker, then they should talk to their provider. And a lot of these could be ordered by your primary care. You don't need to see an oncologist. And then the low-dose CAT scans.
And how about that's for men or women, of course.
Except for mammograms. But for men, you would add in the PSA.
Yeah, the PSA. Because actually men do get breast cancer too, right? What's the percentage of that happening?
It's a very small percentage. I don't know the exact percentage, but I will tell you this. I have had men over the years who I swore had some kind of mutation, something called the BRCA gene, which most people are aware of nowadays, where I could swear that they're going to have it. And I'll tell you, probably one out of all the patients that I've had over the years, which is probably a little bit less than 10, only one of them actually had the BRCA mutation. All the other ones, it was what we call de novo, just happened probably because they got older.
So just getting older puts you predisposition to all of these diseases? All the perks of getting older, right?
Yeah, well, think about it too. As you get older, you exercise less. Your diet changes, your immune system changes. People are living longer, so more exposure to their own hormones. So I think a lot of those things play a part.
Now, smoking. Smoking seems to be one of the major causes of different cancers, correct?
Mm-hmm.
And
alcohol is another one.
So what's a normal consumption of alcohol that would keep you on the safe side?
I don't know. If you read some of the literature, it says you shouldn't drink it at all.
At all.
But I would probably say if you have 1 or 2 cups, like on the weekend, or some people like a glass of wine at night, that should be okay. But pretty much no alcohol is probably best, just like no nicotine.
No nicotine. Now, people who are trying to quit smoking sometimes go into vaping.
Well, vaping has its own issues and it has its own chemicals. So I would say any chance you could not put anything into your lungs is probably best. And if you're somebody who's already smoking nicotine, just slowly cut back, cut down. There's medicines that you could use to shut off the craving to smoke cigarettes.
Yeah. So when it comes to, say, for example, breast cancer or any type of other cancers, right, that are more prevalent among seniors, what advanced technology or science that are already now being used or going through clinical trials that you strongly believe is going to change the trajectory of our prognosis?
Well, I will tell you this. So when I was in training, which is years ago now, that's when something called immunotherapy came out, and that's pretty much revolutionized cancer treatment. What immunotherapy actually does is it actually awakens your immune system to see the cancer that's there, almost like unveiling, like taking off an invisible cloak to our immune system. And that pretty much immunotherapy is used in every type of cancer, breast, colon. It could be used everywhere, depending on certain features the patient has on their tumor. But what's great about it is it usually doesn't make patients tired, not like chemotherapy. Chemotherapy usually knocks you down. This one usually doesn't make patients tired. It also can be used if somebody has an infection, whereas chemotherapy, you'd have to hold it. It could be taken even while patients are waiting and before and after surgery. So what's great about it is patients can be on it a long time, and it doesn't cause a lot of problems like chemotherapy would. So that's something that revolutionized cancer as a whole. Nowadays, probably the biggest thing we could talk about is CAR T-cell, which is something where they actually take your T cells from your immune system and train them to fight the cancer. And we're using that now in something called multiple myeloma and a lot of blood cancers, but they're trying to figure out how to bring it over into the breast cancer, colon cancer, lung cancer realm.
Now, one of the things that confused me,
yes,
is like, why do some people take the infusion of chemotherapy, and also some take the chemo pills? What's the difference? Why would somebody take pills as opposed to the infusion?
So that depends on the type of cancer that they have. Sometimes it depends, like in lung cancer, there are some patients that have a special mutation that cause the lung cancer to happen. And for that type of treatment, that's a pill. So it really depends on what type of cancer it is. If they have any mutations, that certain medicines would work better than others. And also how the patient is functionally. Like I have some patients who I have to put on pills for something like colon cancer just because they don't have the transportation all the time to go back and forth for infusions. So there's different variations of what an oncologist could do, and it's definitely tailored to what's going on with the patient, what their case is. So it's more of a case-by-case basis.
Oh, thank you for that.
Yeah.
Okay, side effects. I am one of those people who actually refrained from going further down my hormone therapy because I could not tolerate the side effects, the muscle joint pains, the sciatic pain. What are my choices in terms of being able to live a great quality of life and still be able to prevent my cancer from coming back?
So you bring up a good point. So side effects is always the hardest, especially for patients who are on pills to block the hormones after they've been diagnosed with breast cancer. Some tricks that I do is if a patient's having a hard time with one medicine, Sometimes I will switch them to a different one in the same family. And I've noticed over the years that just because one causes your problem doesn't mean the second one will. Some other tricks that I'll do is, I'll tell the patient, well, if you're taking the pill in the morning, switch it to the nighttime. Sometimes just a switch in the time of day that they take it helps them have better quality of life while they're on the medicine. In regards to patients, and I have tons of patients that either refuse to go on those pills because of the side effects, or they're on them, we've tried different types, and still they have poor quality of life. Then in those patients, that's when I promote things that they could do. Eating better, exercise, all that stuff.
What are your thoughts about natural supplements? Basically, I am a huge believer of integrating Western and Eastern medicine. What are your thoughts on that?
So I like to consider it complementary to what I'm doing as opposed to alternative. Because the good thing about the medicine that I do is that it's standardized, meaning they've done clinical trials, it's standard of care. So statistically, it works in favor for the patient. So I'm not opposed to holistic, alternative medicine, as long as it's not taking the place of what I'm doing. And I feel like that gives patients more power over what they're doing, because they can make the decision on what treatments I give them that they will take, but also other realms of different types of medications or herbs or things that I don't know about.
Yeah.
As long as it doesn't affect the treatment I'm giving, I am totally not opposed to it.
I love what you said. It's complementary. For me, it works synergistically. And hey, listen, I remember Dr. Tang was saying, like, hey, if it helps you, go for it. But always be in partnership with your medical provider to make sure that none of the things that you're taking obviously contraindicate what they're currently on, right?
100%.
Oh my goodness. Well, it's always very empowering when you are educated on the things that you can do right here, right now in your life to change the trajectory of your longevity and your health. So Dr. Pompa, give us 3 powerful tips that we seniors should be thinking about really very seriously and mindfully to change our lives.
So I think I think one of the biggest things, which I kind of harped on already, is just exercise. And you may think to yourself, well, I'm older, I get these patients, I'm older, I can't really get up and exercise. Don't think of exercise as something where you have to get up and you have to do 30 minutes to 45 minutes of intense workout. Exercise could just be sitting in your chair, stretching, putting your arms out. They have things like chair yoga, Tai Chi, where there's variations for older people, how they modify it so people could do it. So one is exercise. Number two is what you eat. Not that you can't have fun. I mean, I like to have fun. I like to go to Taco Bell, fun places to eat. But just be mindful. You want to put in your body things that are clean. Avoid nicotine, avoid alcohol if you can, except if you're out at a social affair, at a wedding or something like that. And I think the third biggest thing is just be open with your provider. I have a lot of patients that tell me, oh, I didn't want to bother the doctor. Please bother me. That's what I'm here for. I'm here to help you to have a better health, to get through your life without having to worry. And I tell my patients who have cancer, have fun. Just because you have a diagnosis of cancer doesn't mean you can't have fun. Let me bear the burden of your issues and go out and have a lovely day. Every day, do something fun. That's probably the most important thing I could pass on to seniors. Do something fun every day.
Oh my goodness, those are really great points. Filipinos. I'm Filipino and I'm a foodie. And it's like sometimes of course I love sweets, I love carbs, rice.
Yeah.
And, but now I'm just really a little bit more mindful because I know that I also find that if I eat too much carbs, I find that it's not as easy to breathe and do more strenuous activities. And the fact that I'm also going out there having fun and just making my life so meaningful. I remember Dr. Sumi Chang told me when I was diagnosed, she says Ferlie, you have cancer. Okay, I asked a lot of questions. I cried and then I said, so Dr. Chang, how much downtime are we looking here? Because I have a very busy 2022. She started to laugh and she said to me, Ferlie, I love how positively distracted you are because 90% of your cure will come from your positivity. And I truly believe that the state of mind, the state of mind, our being and our attitude towards life, and the joy that we feel and the meaning actually do change a lot when it comes to being healthy, because in spirit, I find that I am healthier that way. So I know that you are on Instagram, so I would love for our viewers to follow you on Instagram. Please look into the camera and tell them exactly where they can follow you on Instagram.
So currently I'm at Miss Blood Doc, MISSBLOOD DOC, but I'm probably going to change it back to its original at Dr. Tiffany Pompa. So I do have another account on there, name that, so if by chance you follow that one, I will redirect you to my active account.
Let me tell you something. You will be inspired when you watch her on social media, because whether you're young or young ones, yeah, you will find that she is very inspiring in giving tips on whatever it is that we need to know that is relevant and current. That is very, very important in terms of being able to manage our health. So, Dr. Pompa, thank you so very much for sharing your wisdom, your beauty, and your positivity, and all of those information that I'm sure many of us would be able to take into our own doctors, so that we can have a little bit more a little better communication with our doctor. And I love the fact that you say, be open to your doctors and let you take the burden. I've never heard a doctor say that, because of course they don't want to carry all the burdens of their patients, but I love the fact that you are in partnership with us.
100%.
So thank you very much. Any last words at all?
Thank you for letting me be here.
And if they want to make an appointment with you, how do they do that?
They could go through the Robert Wood Johnson website. They could call the office, which is partnered with Community Medical Center.
Yeah. Dr. Pompa is actually part of the Robert Wood Johnson Barnabas Health team, and also practices at Community Medical Center right here in Toms River. She is phenomenal. She's very, very easy to talk to, fun to visit. You wouldn't think that going to a doctor would be fun. Oh my gosh, close to twerking we are in her office. But so thank you very much, and I hope that you have found wisdom in all of the things that we shared, and hope that you continue to stay healthy, stay well, have that positive mindset, so that you can be holistically treated and not only hopefully cured, and also be able to live a life that's vibrant, full, and actually very meaningful. Until next time, this is Ferlie Almonte from New Beginnings.